Okay, we're going to talk about how to take a pulse. Now, when it comes to taking a pulse, you're going to perform this practice, or the skill, I should say, and you'll get lots of practice when you're in your angiography and interventional rotation. So when you're out in practicum for your second year, you'll get a chance to work in that department. And what happens is that prior to doing angiography work, we often have a look at what we call the pedal pulses. Now, there are two pedal pulses. One of them is called the dorsalis pedal pulse, or short kind of pedal pulse, and that one is going to be between the first and the second toe along the tendon there. So it's just in this location of the foot. The other pulse that we're going to have a look at in the angiography department is called the posterior tibial pulse, and that is more down by the medial malleoli. So it's the tibial pulse. So we come down here, and what we do when we take a pulse, just like when you take your radial pulse, you're finding a bony surface to press against, okay? Now, when it comes to determining or assessing, I should say, the pedal pulses, the two pedal pulses at the foot, you want to use a very sort of gentle and controlled touch, okay? Because what's going to happen here, so we know we don't have a lot of soft tissue on here. And because we're following along the tendons themselves, we don't want to mistakenly try to take a pulse from a tendon, for lack of a better description, okay? So, and it's a little trial and error, okay? It's a little trial and error. But what we're going to do is we are going to go down between the second and the third toe along that tendon there, and we're going to use two fingers, and we don't eagle talon, like we don't use the ends of our fingers, we use as much surface area as possible. Now, some people, whether they have a history of frostbite or perhaps they've done a lot of manual labor, they've lost the sensitivity in their fingertips for whatever reason. So just be patient with yourself, and when you are applying that pressure to determine how assess that pulse, just keep in mind you're going to have to make very slight and subtle adjustments, okay? So you have the general idea, vicinity of where it is, and you're going to apply a very controlled pressure as we're feeling for this pulse, okay? Same with the pulse down here by the medial malleoli. What we want to do is we want to maintain and hold that pulse at least a full minute. And what we're doing is we're assessing whether it's regular or irregular, whether it's weak or strong, whether it's thready or not. So there's a lot of information about the pulse that we're trying to gather as we are doing the assessment of these two different types of pedal pulses. The reason being is when an angiography procedure is done and we do assess the circulation in the legs, the procedure itself has a risk and a complication where we can affect the pulse. So we take a baseline pulse prior to the procedure, and then we do a comparable after the procedure. As you start to work and build that skill when it comes to taking a pulse, just keep in mind, you're better to say, you know what, I can't find it. That's the way it is, I can't find it. And somebody else, one of the other technologists, when you're working in angio and in interventional, there's a lot of crossover and responsibilities as far as you working as a team. It's a very, very team-orientated department, the angiography and interventional. So, just say to the other, angio nurse or another tech, I can't find those pulses. Can someone else have a try, please? Okay? And we just keep in mind, you do them on both feet. Okay? You won't just do them on one leg, you'll do them on both feet. Patients that you'll typically come across will be the ones who have smoked, they're lifelong smokers, so they have, compromised circulation, or diabetic patients, things like that. So we do angiography procedures all the time. And so this is one of the main reasons or occurrences where you'll have to take a pulse. So there you go. There's your two pulses. Just so you know, the radiologist, when we do these angiography procedures, they will access the femoral artery. Okay, so there's the femoral pulse. Then we have, of course, our radial pulse, brachial pulse for the little ones. And then we have the carotid. The carotid is really quite actually not as easy to palpate as one would think, because often you have a lot of soft tissue in there, and again, you have to find a bony surface to press that vessel against. So but the majority, 99% of the time, you're going to be assessing these pedal pulses in angiography. Okay, there you go.